you may find after discussion with me that the best option for you is a neck lift. With time, age, and also genetics, some people may have a prominent neck with loss of the angle of the neck. The neck lift is a procedure that takes place under general anaesthetic, so you'll be asleep. The surgery takes place through an incision at the base of the chin. This will allow me to corset the two edges of the muscle and reposition in the angle of the neck. You will need a further incision in front of the ear, going underneath the earlobe into the hairline. The aim of the neck lift is to improve the angle of your neck, particularly from the side profile, but also from the front profile. For some people, the laxity in the neck can be significantly excessive. For these people, there may need to be more than one surgical procedure to give them the best results possible. The first procedure will be a general anaesthetic procedure, and then after things have settled down and we have the final results, you may need a local anaesthetic procedure to further tighten the skin or muscle approximately a year or two after surgery. This is a decision I will make with you in the clinic. The bandaging and recovery for a neck lift is very similar to a facelift. After the surgery, you will be completely bandaged up. This dressing will need to stay intact for a full week. During this time, avoid any heavy lifting or bending over. If you do need to bend, bend at the knees, keeping your head up. A soft diet. It's important to have a soft diet a week after the surgery. Sleep slightly more upright. You may get some ooze on the dressing which can become stained. This usually stops, however, it may be persistent over the first 24 hours. Apply gentle pressure over the area for 10 minutes and it should stop. If you do have any problems with this, contact us and we'll be able to guide you. In the first week, just relax. Start using the retinol and vitamin C 3 days after surgery and 5 days after restart the light therapy mask. This needs to be 10 minutes a day, twice a day for 2 weeks. Risks of surgery. Infection. All surgery has a risk of infection and we will give you antibiotics on the day of surgery. If there are any signs of redness and swelling, we will manage this accordingly. Bleeding. This can occur in the early stages, and depending on how much this is, we will either treat this accordingly with a very small number of people going back to theatre. Swelling. This is common with most surgeries, and with the face surgery, the swelling may concentrate in the lower part of the face. In the initial instance, for the 7 days, you will need to sleep upright on a couple of extra pillows or a V-pillow. You need to avoid bending over or heavy lifting in the first 2 weeks, and this will help with the swelling. The swelling can take many months to settle, and if you are having fat graft, the swelling can be significant, but it does settle down. Asymmetry. No one has a perfectly symmetrical face, and after the surgery, there is always a risk of asymmetry. Most of the time, this is considered within normal limits. Lumpiness. With scarring and muscle swelling, as well as fat grafting, you may notice some lumpiness. This does settle with time and massage. Pain. There may be some pain, and with a neck lift, you will get throat pain. It will be difficult for you to swallow for the first week. Avoid solid foods during this time, and it will settle. You may get some pain along the scar also. Discoloration of the face. Old blood may clot underneath the surface of the skin, giving a bruised or discolored appearance. It will go away on its own, but massaging the area may speed up the process. Scarring. Scars are designed to be hidden as possible in the crevices of the face. They should fade with time, and you can buy creams and oils designed to improve the appearance of the scars. They can sometimes become red and lumpy and needs massage and occasionally steroid treatment. Slow healing. If you are fit and healthy, you should heal well. However, people who are smokers or have a history of diabetes may take longer to heal. They are also at a higher risk of infection. Loss of feeling. It is likely that you will get some numbness of the earlobes and abnormal sensation of the skin. For some, this can be permanent. However, for most, this can improve with time. Nerve injury. There are multiple nerves in the face, including the facial nerve and the marginal mandibular nerve. In rare situations, this can be injured or swelling can affect the nerve. If this happens, you will be followed up and usually it settles with time. But if the nerve injury has occurred, we may need to transfer your care to the Norfolk and Norwich Hospital. This is very rare. Asymmetry. Some patients with a prominent neck may also have prominent underlying structures. This includes the salivary glands and other muscles called the digastric muscle. When the platysma muscle is tightened into the neck, it becomes closer to these deeper structures, which may sometimes appear protruding, and this may appear as a small bulge on either side of the neck. I personally don't operate on salivary glands as standard due to the risks, but we can discuss this in further detail. Another reason may be there has been a recurrence of the weakness of the muscle in one part of the neck. This is a risk, and we will make a decision where we need to do further surgery on this. Secondary surgery. The procedure changes the position of the neck and the muscle by lifting it. It does not change the quality of the skin. This will need to be maintained after the surgery, and we will advise you to do facial exercises after the surgery. It's advised that after the main surgery, you may need smaller skin excisions at a later date to help fine-tune the surgery. Side effects of anaesthetic. You may feel nauseous for a while, and you will be given anti-nausea medication to counteract the uncomfortable feeling. Anaesthetic may also take a while to leave your body, but it will leave eventually. General risks. There are also risks associated with surgery, including clots in the legs, clots in the lungs. To reduce this, we advise no long-haul flights 6 weeks before surgery and 6 weeks after surgery. Other risks include chest infection, and it's important to keep doing the exercises we advise. Long-term results. The necklift lasts many years. However, the natural aging process will always take over, and you will need maintenance down the line. This does depend on the quality of the skin and how things are maintained. Psychological effect. This is a confidence-boosting form of surgery. However, during the period of recovery, it is normal to feel frustrated and low. It's important to trust the process and be aware that we are there to support you through your journey. Thank you very much for staying till the end of the video, and I hope they're informative. If you have any suggestions or would like any further information, please contact my PA and we'll be able to answer your questions as best we can.